Hi, everybody. Welcome to our wellness group. Happy Thursday. Today you're in for definitely a treat. We're going to be talking about traveling with diabetes with Dr. Nancy Shin. She's one of our pharmacists at Stanford. She's a clinical pharmacist and certified diabetes care and education specialist. She's been working with Stanford Healthcare for 7 years and teaches diabetes education classes with our diabetes care program. She works in our primary care clinics, helping patients manage their medications and live their best with diabetes. So we're so lucky to have you, Nancy. Thank you so much for sharing your pearls of wisdom. And without further ado, I'll turn it over to you.
Thanks, Leah. Hi, everyone. Good evening. Thanks for joining us today. We're going to be spending the next 30 to 60 minutes together talking about traveling with diabetes. I hope that this is a really informative time for everyone. So the objectives for this talk today are threefold. First, we want to learn how to plan ahead when traveling with diabetes, learn how to travel particularly with medications and testing supplies, and lastly, understand the impact of lifestyle changes on your blood sugars while you're traveling. So before we begin, I'd just love to know if anyone has any upcoming travel plans where you might be going for the summer. If you wouldn't mind sharing some of that in the chat box, I'd love to hear your destinations.
You have somebody going to Japan in July,
Nice.
Texas,
Okay.
South Carolina, Egypt, Colombia, and Costa Rica.
Wow.
All across the map. Germany.
Excellent. Wow. So many different places. That's really.
And a Rhone River cruise in the fall.
Wow. So I see a lot of destinations, both domestically and international. That's really fun to see and really fun to plan for. Someone says they're not traveling. Okay, well, maybe for the future. Thanks for sharing, everyone. Great. So it's really fun to kind of plan vacations and travel. It gives us something really to look forward to. And I think part of the excitement is just doing something that's out of our routine and kind of doing something that might be unexpected or unknown. So while that part is really fun while we're traveling, I think when we run into medical problems while we're traveling, it's not fun. So really the purpose is to kind of think ahead and plan of how we can prepare ourselves to not have to worry about those things and really focus our time on having fun while we are traveling. So where do we start from? So we want to think about all the different things that are going to be involved in our travel site. And the motto for this talk is really to be prepared. So we want to think about lots of different factors. And I'm sure some of you have already considered these things when you're planning your trips. But the first thing is, what kind of accommodations will we be staying in? And this is obviously just very important in terms of how we're going to stay in a place, how we will be able to access sleep or medications, where we might store our medicines. If you have medication that needs to be refrigerated, will we have access to refrigerators? Will we have access to food and certain items that we might need to help treat our diabetes? Obviously, food and exercise has a big impact on what happens to our blood sugar. So thinking about what types of foods might be available, what type of activity or exercise might be involved in our itineraries is going to impact how you plan for things. How will you get there? It sounds like a lot of people are traveling far and away. So maybe it might be by airplane, maybe by boat or cruise, maybe just local road trips in the car. So kind of that travel time is also just a time to prepare in terms of transporting ourselves, our medicines, and things like that. Hospitals and pharmacies and clinics, those are things that we, hope that we never have to visit during our traveling, but definitely important to consider. If we are going to be away from home, how can we access healthcare if we need it? And then in relation to kind of the care that we're going to get, but how can we also access emergency medicines if we need it? So these are, clearly things that we hope that we won't have to encounter, but definitely want to be prepared for in case we do. Other considerations are just our general health status. So for some people, it may be important to consult with your doctor or providers to ensure that you're in good health to travel. So thinking about what else is going on, if you're having some surgeries or procedures, or if you're undergoing therapy, things that maybe you want to work around and plan for the timing of your trip. The length and location of the trip may matter too. If you have to have access to certain types of medications or medical care, definitely consult with your doctor to see how that can be managed while you're away from home. Some countries require certain vaccinations for entry into the country. So if you do have to have some vaccine series, definitely look into that ahead of time, at least 1 or 2 months ahead of travel. In the past, we really were, looking at COVID-19 testing, vaccination records, and that was an integral part of how we traveled internationally. I think a lot of those things have changed over the last year. So really look into your individual country that you might be going to see what those requirements are. And really the best tip I have for international travel is to look at the CDC travel website. And here's the web address for that there. But I like the CDC travel site because it's very easy to navigate. It has a wealth of information and links to access. So this is just a screenshot of the homepage right here. But what you do is just plug in your destination. It has like every single country you can think of. So you plug in your country, and then it takes you directly to that country webpage. And then on here, you can see different travel health notices, vaccines and medications, advice for travelers, finding a clinic, things like that. So this can be a really great starting point in terms of how to look ahead for things. Other things that you might want to consider packing for your trip, medical identification bracelet, or just some kind of medical identification. Can be like a wallet card, something just to identify that you do have diabetes or any other health conditions that might be important in case of an emergency. A list of local hospitals and pharmacies where you will be traveling to. Again, just for an emergency situation, it's nice to know where your closest medical care access point is and how you can reach that destination. And then also looking into your health insurance in terms of travel coverage. So some health insurances may cover broadly across the US. They may or may not cover internationally. Some places may only have coverage in certain regions, or it may have additional travel insurance. So really look into the details of how far your health insurance is going to cover, and you can also consider additional travel insurance if needed, but also looking to see where that insurance is accepted in relationship to local hospitals or pharmacies. A documentation of your health conditions and medications can be helpful. Again, if you are traveling out of the country in particular, having kind of a written statement of the medications or supplies that you might need. Some people may request from your providers, just like a general medical letter saying that you have diabetes or other conditions, why you may need to travel with certain medications or supplies. And then the last thing you might want to consider or asking from your provider, maybe some prescriptions that might be needed depending on where you're going. So again, vaccinations may be required in some places. It might be recommended to travel with kind of preemptive antibiotics or altitude medications, motion sickness medications, things that you may need, again, if you encounter something while you're traveling, anti-diarrhea medications, things like that. So in terms of preparing the medicines for travel, this is always kind of a question that comes across because if you normally go to the pharmacy and you are trying to refill your medicines ahead of time, most likely you won't be able to get it because your insurance won't allow it. So in the case of where you are planning to travel and maybe your refill is not coming up at the right time, talk to your pharmacy to see how you can get what's called a vacation supply for your chronic medications. And if you approach the pharmacy at least 2 weeks ahead of time, sometimes they can override or request to the insurance to fill your medicines early so that you don't run out. Some domestic retail pharmacies may be able to transfer prescriptions across states in terms of chronic medicines. That doesn't usually apply to controlled substances, but kind of your basic medications, they might be able to do that. Usually medications can't be sent abroad. So if you are traveling out of the country for several months, really do kind of prepare that stock ahead of time to bring with you. Research your travel areas for laws on how to obtain medications if you need it. So again, laws are very different in every country, so it can be handled in different ways. And then lastly, if you do need to access medical care or medications in another country, there are some resources for international travel, like the International Association for Medical Assistance to Travelers or the International Society of Travel Medicine. So these are just some additional resources that can be looked at ahead of time.
Nancy, you have a question. Is that okay?
Yeah, go ahead.
Great. Being on Medicare, do you know if pump CGM and medicine supplies can be purchased beyond the typical 90-day limit? Traveling to Europe for 5 months will be a stretch. The limit in buying with personal cash doesn't appear to be recoverable.
Yeah, unfortunately, that is a difficult point because really, I believe most insurances, even Medicare, will limit the coverage for a 90-day supply. Typically, what people may have to do if you are going for past that 90 days is if there is somebody that's able to mail you your medications, so you can kind of have them shipped over while you're away, is usually the best way to handle it. Or otherwise, you can try calling your insurance company and seeing if they will allow it, but in most cases, it's not. Right. Other kind of tips with just traveling with medications. So if you are traveling on an airplane, we do recommend keeping your diabetes supplies in a carry-on bag with you at all times. So these are things including all medications, insulin, glucose meters, readers, glucose tablets, maybe healthy snacks that you need on the airplane. When medications are packed in the carry-on and those go into the cargo space, I'm sorry, I'm talking about insulin. If insulin is packed in the check-in bag, excuse me, into the cargo space, because the pressures and the temperature in that space can be colder or higher, it could potentially damage your medication. So it is recommended that you keep it on you in the airplane. For some medications that might need extended refrigeration time, you can consider traveling with a cooling pack. So these are kind of packs that can keep medications at a certain temperature, like refrigeration temperature. Sometimes ice packs can cause, like ice itself can cause freezing of like medications like insulin. So just want to be careful with that and maybe consider something like a Frio pack, which is like a water activated pack. Most insulin or injectable medications can be left at room temperature for up to 14 to 28 days. It really depends on the product. Some have a short expiration time at room temp for 14 days. Some have a very long one, like 56 days. So it really depends on each product. But if you're only traveling for a week, you know, and you have a new pen, for example, then that may not necessarily be needed to be refrigerated. So kind of think about your time and how many supplies that you'll be needing to take in terms of refrigeration.
Nancy, you have another question. Do you have to keep oral meds out of the cargo space, or can they be in the cargo space?
Our oral meds are okay, like tablets, that's fine. You can put in your suitcase. But still sometimes, because luggage can get lost, I would just recommend keeping it with you if you can. Other things just to kind of make the travel with medications easier. If you go through airport security, especially maybe in another country, it may be helpful to just bring the medication labels with you. And so you can either bring the medications in the original bottle, or if you want to pack your pills like in a Ziploc bag or something, just make sure they are labeled. So that's really the key thing, is to have a label with like your name and medication name on it. So if you do go through security, that there's no, questions or concerns about that. Don't want to travel with just like a baggie of unlabeled pills and things, because you may get more questions that way. Other things to pack for, glucose tablets, maybe gummies or hard candies if you need for low blood sugar, extra testing supplies. And this is really kind of an area that I would say overpack, because it's the worst to have to kind of scramble for these things when you're somewhere else. So think about all your testing supplies, like your strips, lancets, your medication needles or syringes, additional pump supplies, alcohol pads, extra, if you use a CGM, extra sensors, and then also a backup glucose meter. And then also just, of course, any charging cables for all of your devices. Also just recommend packing some good shoes and socks, especially if you are traveling places where you're planning on doing a lot of walking or activities, because we always want to think about good foot care while we're traveling with diabetes. And then last things to consider, just some over-the-counter basics. So things like first aid supplies, antibiotic ointment, sunscreen, bug spray, anti-itching medications or diarrhea medications or antacids. So may all be things that we need. And just, I don't know about you, but in my experience, when I travel somewhere and I don't bring something, that's when I usually need it. So if I tend to bring something and I overpack, I end up not using it. So in some cases, it's just a safety net there. Okay, so we've done kind of a lot of research. We've done a bunch of planning and packing. So what happens when we get to the airport? So just some things to know. People with diabetes are exempt from the liquid restriction rule for medications and testing supplies, as well as gel packs for your insulin. It is best to inform the TSA agent before your screening. And again, separate out your medicines, have them all labeled and ready to go for ease of screening. We already talked about not storing your medications and supplies into your checked bag because of the extreme temperatures and pressures. And then you can consider getting like a letter kind of documenting why you might need certain medical devices while you're traveling. And there's a really nice letter template on the Dexcom website if you wanted to ask your provider to write something like that for you. So in terms of traveling with medical devices on you, there are some restrictions in terms of CGM items or pumps going through certain scanners. They typically, so in general, CGMs can go through the metal detector, just traditional metal detector, as can your tube pumps or your Omnipod patch. But they don't recommend going through X-ray things like your X-ray luggage scanner or that full body magnetic full body scanner. So just kind of thinking ahead of what may be on your body when you're going through security. You can always request for the metal detector check or doing a hand inspection. Sometimes things like TSA pre-check can make the security process a little bit easier. If you do plan to use your continuous glucose monitor while you're on the plane, just they can still work in airplane mode as long as your Bluetooth is on. So that's really the key thing, is to keep the Bluetooth on. You can keep your Libre reader and Dexcom receiver on. Omnipod suggests using the airplane mode as well. I didn't include every single product on here, but there should be also individual instructions if you have different pumps on the manufacturer website. If we are traveling by car, so that kind of puts in a different perspective of like how we're going to be traveling, the time, what we're going to be eating. So as we all probably know, when we are driving along the highway, sometimes the food options on our way to our destination are not necessarily the most healthiest. So consider just packing a cooler with maybe some food that's a little bit more healthy. Definitely want to bring a lot of water while you're traveling as well. Please also just remember not to keep your diabetes medications and testing supplies in the direct sunlight or in a hot car, remembering that like even your test strips have expiration and certain storage requirements. So just try to keep those in a cool place. If you're traveling across time zones and you already have kind of certain regimen of when you're taking your medications, maybe setting alarms to remind you to do that can be helpful for timing. Okay, so we arrived at our destination. So now what happens? So we do kind of want to be a little bit lenient in terms of that first 24 hours of adjustment. Depending on where you're going, there may be several time zones you've crossed, or you're maybe on the other side of the country. So thinking about how to reschedule and kind of getting you back on track to your normal routine can take a little bit of time. So reschedule your medications as needed to your new time zone. So if you normally take your metformin in the morning, kind of plan it out to get you back onto that schedule while you're traveling to be back on that morning routine. For your day of travel, sometimes your insulin needs may be different, and really talk to your providers about how you might have to adjust your insulin during travel time. Just in general kind of rules of thumb, right? If we're going eastward travel, there may be less hours in the day. You may need less insulin to cover you during that time, and then reset starting that new day. Whereas if we're going westward travel, there may be more hours in the day. You may not need extra insulin, or you might just have to keep a closer eye on things. But basically, that maybe first 24, 48 hours, there might be a bit of an adjustment period. When you are at your destination, really the best piece of advice I can give is just to monitor your blood sugars more than usual. Because when we are traveling, again, the whole point of traveling is to be away from home and to do something that is not part of our routine. So we can definitely imagine that we might come across things that are unexpected. So keeping in mind that blood sugars can fluctuate with many different kinds of changes, including the foods we might eat, different exercise activities, what our sleep patterns are like, how stressed we might be, our hydration status, and then again, like the timing of our medications may impact our blood sugar control. I'm going to pause and answer a couple of these questions in the chat box.
Oh, yeah. I think the only one that we're missing so far is, can you use test strips if expired within 6 months? Everything else you've answered.
Okay. So no, I mean, generally the expiration dates are there for a reason. I would say 6 months is a little far out to use an old test strip. Okay. So this is just a little bit of an exercise with everybody here, but planning around our activities. So these are just things that we might want to anticipate in terms of blood sugar changes. So if we are planning on going hiking, let's say, what do you think might happen to our blood sugars? Do you think our blood sugar would go down or go up, or maybe stay the same?
Can people put their answer in the chat? Oh, they are. People are saying down.
Thank you. Okay. Down, down, down. Everyone's like unanimously saying down. Yeah. So, things like aerobic activities like hiking or walking would probably lower the blood sugar. That is typically something that we expect. For some people, it may not change too much, just kind of depending on the intensity of activity or just yourself too, and maybe certain medications that you might be taking. But in general, we can kind of anticipate if we are going to go on an activity like hiking, we may see a drop in our blood sugar. So kind of planning ahead of time, what can we bring on our hike, or how can we kind of make sure our blood sugar is at a certain level before we go? Just things to consider before we do that. Laying out on a hot beach in Hawaii, what do you think might happen to our blood sugars? Someone said stay the same. Someone said go down. Someone says go up if you ate before. Yeah, eat like a nice full meal and just lay out on the beach, right? That sounds nice. So in this case, it's really hard to predict, but perhaps maybe up, maybe stay the same. If we are kind of in a hot area and not hydrating well, sometimes our blood sugars can go higher. So if our body is dehydrated, we do tend to see a rise in blood sugar. Or in some cases, it may not change at all. So of course, it really depends on every situation. So thinking about how to prepare for an activity like this, bring plenty of water, really just hydrate well while you're kind of relaxing out on that beach. What about walking on a city tour? Let's say someone's going to Europe or Japan and we're doing a lot of walking. Down. Yeah, everyone's saying down. And I would say this is probably a case where we would say going down as well. And so this is something important too, right? Because if we're thinking about we're going to be doing a ton of walking and maybe that's not our usual routine at home, our blood sugars may drop. So again, kind of preparing for that, maybe bringing some glucose tablets or snacks to bring around for those kind of activities. But also thinking about like if you're on insulin, for example, perhaps maybe sorry, I just saw someone said, unless you stop for ice cream, that's true. So perhaps maybe you don't need as much insulin before your meal. Let's say you're having a meal and then you're going for a walk. Maybe you're going to need half the amount of insulin that you normally take. So things like that can really impact your sugar. But yeah, I know one time we were in Europe and I think had gelato like every day, but it wasn't really a problem with blood sugars because we were walking so much. But yeah, so blood sugars can go down, can stay the same. Just want to anticipate for that. Visiting family at their home. So let's say we're going back to a country maybe where our family is. We haven't seen them for years. What do you think might happen? Go up, the same. Up if you're stressed. Oh, that's very true. Yeah, I think family gatherings can be fun, but also stressful. And in certain cultures, I think we tend to show our love to our family with food. So oftentimes, I think we tend to overeat, right, in those kind of cases. So, it's sometimes hard to politely decline those things, but blood sugars may potentially go up during this time. So again, maybe thinking about how you might need to readjust your medications to kind of account for those larger family gatherings. And you can talk to your providers about how to handle that. Okay, and then lastly is sleeping in. What can sleeping in do for you? Oh, there's silence on this one. Okay. Yeah, and because we don't actually really know, it can go out anyway. So sleeping in, maybe, we're sleeping extra and we, miss our usual breakfast time. Maybe our blood sugar tends to drop overnight. Maybe in some cases where you're having dawn phenomenon and that blood sugar is rising higher in those early morning hours. Maybe for some people, it's just the same. It doesn't do anything. or maybe because we're catching up on our sleep, or we're less stressed, our blood sugars look better. So there can be lots of situations that happen. But really the whole idea here is that we don't always know, and what we can do our best to predict what might happen. The best thing to do is really just monitor the blood sugars, keep a closer eye on things, just to kind of expect the unexpected. Okay, and so what should we eat? So this is really a challenging thing, right? Because part of the joy of travel is to experience different foods. So we definitely want to be able to enjoy those foods, but really the key thing is just to, monitor your portions and try not to overdo. Things like cruises tend to have a lot of options for buffets, all-inclusive resorts, if you're going to anything like that. So buffets are great options because they have variety, but nobody is stopping you from, getting more. So remember kind of your plate methods, try to stick to your 9-inch plate, and just try to avoid, overdoing it. Keeping alcohol in moderation, again, because this may not be part of our daily routine. Of course, you can enjoy your alcohol, but do keep in mind just the general recommendations for people, for up to 2 drinks a day for men, 1 drink for women per day is kind of the recommendation there. Spacing out your meals. So it could be helpful to, everyone has different eating patterns, but spacing out your meals so that you're not overdoing all at one time, but rather throughout the day can also help keep your blood sugars more stable. And then lastly, really just recognizing your carbs. So carbohydrates come in so many different forms, right? And I think that's probably one of the biggest struggles of living with diabetes, is that there's just carbs in everything that we eat. So just being able to recognize that the carbs that may not even be familiar to you, and kind of researching that ahead of time in terms of what types of foods may be more common in certain areas or countries that you're visiting. But remember that carbs come as grains, so anything that grows from the ground, right? So your rice, your potatoes, your breads, pastas, tortillas, noodles, dumplings, all those things basically are grains. All your fruits count as carbohydrates. Starchy vegetables like your potatoes, sweet potatoes, or root vegetables, corn, peas. Your dairy products, so things that are like yogurt, milks, ice cream, all of those do contain carbohydrates. And then just kind of the excess things, so like your sweets or desserts, things that have added sugar in them, sauces that we put on our foods, maybe like sugary alcoholic drinks, that may be part of just the fun of travel too. So really just being able to recognize what your carbs are on your plate is going to be best tool to kind of keep the blood sugar stable. So, thinking about kind of our general plate method, right, about 25% of our meal can be carbohydrates, recommendation for 50% for vegetables, 25% for your lean protein. So keep those in mind, keep your portion sizes in mind. And then if you are unsure of what a food is, you can always look it up. Calorie keying is a reference that we use frequently just to kind of access carb content of different foods. Not sure how much international products there are on there, but there definitely are some that you can, again, look ahead of time to find out. Let's see, and then the last thing here is really just kind of listen to your body. So when we are traveling, again, trying to be mindful of what might be happening to all the different changes that we're going through. So remember the signs of low and high blood sugar. So if you have had low blood sugar before, I'm sure you know what those symptoms are. But if you've not had low blood sugar before, remember kind of looking out for signs of feeling shaky or jittery, sweaty, dizzy, kind of feeling out of sorts like that. Symptoms of high blood sugars can be feeling very thirsty or urinating frequently, extra tired. Some of the symptoms are a little bit hard to tease out depending on what your activities are, but really just pay attention to the symptoms that your body is giving you. Monitor blood sugars. So really, again, this is probably the best way to see what is actually happening to your body. So keep a closer eye, maybe test more frequently, test before and after certain activities, and just keep an eye to see what those sugars are telling you. Check your feet daily. So this is, just a general kind of diabetes maintenance thing, but just a reminder to everyone that wounds can happen, and when our blood sugars are high, sometimes those wounds and infections are a little bit harder to heal. So really try to prevent that by preparing good footwear, checking your feet, make sure that there's no harm on your feet. Don't forget to drink water. So this hydration, again, is really important, both during your travels, like on the airplane or in the car, but also just kind of on your day-to-day activities. And then lastly, just really, I hope everyone enjoys themselves while they're traveling, because, part of the reason why we put so much time and effort and money and planning into doing this is really to improve our happiness and health, right? We travel for fun, hopefully in most cases. But really by going away and kind of enjoying ourselves, we can lower our stress levels. And when we have lower stress, our blood sugars get lowered too. So overall, we're doing this for our health. So I hope everyone just enjoys their traveling this summer. And these are just some resources that I had alluded to earlier, just some different organizations that can be helpful in your preparations. And I'll take any other questions at this time.
I think somebody has a comment and it's just kind of saying, is it better to take vegetables, protein before carbs? Some articles state that this order might be preferable for lowering your blood sugar load.
Yeah. Leah, do you want to comment on that?
Yeah, sure.
I do think there is some evidence behind that order, but I'll let you take that one.
Yeah, great. That's a great question. So there has been some research. So they bring people into labs and they have them eat a preset meal, and then they wait, and then they have them eat the other half of the meal. And they've found that having protein and fiber, like a salad with lean proteins on it before, maybe 10, 15 minutes before having the carbohydrates, sometimes can be helpful for lowering postprandial blood sugar. If that's something that you're able to do, like if you're out eating and you can get a salad up front and then have your mashed potatoes and whatever else you want later, I think that can definitely work, but everybody's different. So experiment with what works for you. Any tips for dealing with TSA, getting through security with pumps and CGMs and not getting a full body pat down? Nancy.
Yeah, so I mean, I think we have to, so the best thing to do is just inform them ahead of time if you are wearing a pump or a CGM. Again, sometimes people like to bring like a medical device letter if you feel like that might be a problem. Depending on your CGM or pump, you may be able to just go through the metal detector without having to do the pat down, but it may also depend on what kind of pump you have.
Okay, diabetes is new to me. What should my feet look like with high or low blood sugar?
Great question. So I wouldn't necessarily say that your feet will have direct symptoms based on your blood sugar levels at that particular time. What we're really mostly concerned about is if you have running high blood sugars over a period of time, that can at some point maybe cause some nerve damage issues. So sometimes when people have nerve damage, they don't feel things very well on their feet. You can get some numbness. And so if that happens, then, sometimes we might have wounds or cuts or sores that we may not realize are there. So that's really the concern. But on a kind of day-to-day level, you probably won't feel anything different in your feet based on the glucose level.
And then someone's asking, lots of great questions. Do you know if you can wear a freestyle Libre when scuba diving?
Oh, I don't think so. You can double check, but I believe the limit for freestyle Libre is up to 3 feet underwater, and for 30 minutes. So you can double check their website. They do have the limitations there, but I don't know if it's tested for scuba diving.
Yeah, on the website it says feel free to swim, shower, and exercise with your Freestyle Libre sensor, but it doesn't. It says it's water resistant. I think maybe if you go deep down, it might offset pressure. That's a good question, though. The first day of travel, should you stay on time at home for medication and then slowly get to the local time?
Um, I guess that depends on like where you're traveling to. And what time your travel is. Like if you're taking your medications usually in the morning and you're traveling that day, that's fine. If you tend to take your medications in the evening time and you are traveling different time zones, it depends on like how far away you are from your usual time zone. So let's just say if you're just traveling domestically and you're just off by a few hours, and that's probably fine to just adjust to that new time zone at the time. If you're going internationally, it is a little bit trickier. If you have an example, we can try to maybe figure that out.
Okay, we'll watch for that. And then will the dawn phenomenon be something that travels with you in a different time zone, adapt to the different time zone?
That's a really interesting question. I would think so, because it really has to do with the cortisol hormones that happen like when we're sleeping. So the dawn phenomenon kind of goes into effect when our body is just trying to kind of wake us up for that day. So I believe you may see that same kind of morning rise based on your sleeping pattern.
Great. We have more follow-up to the prior question. So they're talking about going to Europe.
Oh, okay. Yeah, so that is tricky. So if you are going to Europe, so I would try to take your medications the day of the travel at your normal times, and then maybe do a time set alarm. So like if you normally take your medicine 12 hours later, then set an alarm for that 12 hours. It's 24 hours later, then do it at the 24 hours. And then you probably just need a couple of days to kind of slowly shift that, whatever your normal medication timetable is, back to where you want it to be. Depending on the medication too, there may be, some are a little bit more specific as to, very specific times, or you cannot miss a day, whereas some like, if you miss, maybe one day in between, it's, probably not as bad. So definitely talk to your providers and see if there are specific time schedules to take those medicines.
That's great. You have another question? I have a question regarding when flying and having your pump in airplane mode. If your tubing comes out, what are the recommendations? When your pump is in airplane mode, can you change your set and do the calibrations?
I see. Oh, so I think this is really pump specific. I unfortunately don't have a great answer for this, but definitely check ahead of time with your pump manufacturer and see what the backup options are. It may also be, advisable again to bring backup things. So if you may need to, just bring an extra insulin pen or vial to kind of give yourself in case your pump does malfunction on the plane.
Yeah, I think that also would depend on the insulin pump, but most of them you can change like the tandem you change on the pump, and then you could just sync it up to your T-Connect when you arrive. But then they're talking about tubing, so it's not Omnipod. That one, like OP5 is with phone. But yeah, if you have more questions around this, maybe we can reach out to you a little bit later. Ask your provider who prescribed the pump, I would say. Somebody also said I always shift my new time zone as soon as I board the plane, and it's worked well for me for many trips. That's a good suggestion. And then we have another follow-up, Nancy. So I think that person who was asking about the Europe trip mentioned that they're on Ribelsis.
Oh, okay. So Ribelsis does have to be taken on an empty stomach. That's really the key thing with Ribelsis is it has to be done on an empty stomach at least 30 minutes before any other medication, food, or drink. So if, you know, depending on the travel time and kind of where you are at, I would follow just based on your, you know, your next sleep cycle and do it at a fasting, your next fasting state.
Great. And then somebody asked about the recording to rewatch. The recording will be uploaded to the Health Library website under the Diabetes tab. And I do apologize. A couple of our recordings, they didn't end up working or somehow got lost in translation, but I've worked with lots of IT people. So this one should definitely be good to go. But you can also see our prior talks there as well. The Stanford Health Library website. I don't see any other questions. I think people are saying thank you. I think, Nancy, you had the most questions. I think in our group, we have lots of world and domestic travelers, lots of people who want to live life to their fullest and see the world. That's great. And I hope that people can really enjoy the food on their travels and really get to immerse themselves in the culture that wherever they're going. That's part of the fun.
I agree. Yeah. Thanks everyone for making this a fun talk and for your participation and great questions.
Yeah, great. Thank you. Thank you, Nancy, for your hard work putting this together. It was so well organized. I feel like I learned a lot too. So thank you. Bye.
Bye, everyone.